Occupational therapy practitioners work with all individuals with many different conditions, whether they are mentally, physically, developmentally, or emotionally disabling. Occupational therapy practitioners assist individuals to improve basic functions, develop, recover, and maintain daily living and work skills. Occupational therapy practitioners' overall goal is to improve clients' independence and increase overall satisfaction and productivity in life. Specific functions of an occupational therapy practitioner may include creating individual treatment plans, completing evaluations on home, at work, or on clients. Other functions include recommending and educating on use of adaptive equipment, as well as educating family and caregivers. Overall, practitioners provide skilled treatment and use evidence-based practice to help individuals achieve their goals.
Occupational therapy practitioners work in a variety of settings, such as rehabilitation in psychiatric hospitals, skilled nursing facilities, pediatric clinics, schools, home health, industrial settings, community mental health centers, adult daycare programs, and health and community wellness.
Occupational therapy practitioners serve many different populations and groups, such as persons of all ages, from pediatrics to geriatrics, persons from all cultures and from all levels of education and economic status, persons in need of rehabilitation after a serious illness or injury, persons addicted to drug and alcohol, the homeless, those suffering with a mental illness, children with learning disabilities, and adults who lack job skills, as well as many others.
The field of occupational therapy is unique in that it uses occupation as a means and occupation as an end in treatment. Occupational therapy practitioners use occupation as a means to improve a client's impaired abilities to enable occupational functioning. The therapist and client will identify and develop the skills necessary to complete a meaningful occupation to further enable the client to manage their lives safely, maintain their independence, and improve health and well-being. Occupational therapy practitioners use occupation as an ends as a functional, meaningful goal for the client. The therapist and client will use the occupation to maintain important life roles and determine how to match the demands of the task to the client's current capabilities.
Occupational therapy practitioners acknowledge that participation in occupation occurs in a variety of contexts. These include virtual, temporal, physical, cultural, spiritual, personal, and social. Practitioners also understand that the client's personal experiences cannot be evaluated without comprehending the multiple contexts in which occupation takes place. For example, in a physical context, occupation can take place in many environments and involve many objects, such as space and size of the treatment area and adaptive equipment. In a social context, the client can participate in occupation in both individual or group treatment sessions. Occupational therapy practitioners acknowledge attitudes, beliefs, and values of every individual client and their occupations within their cultural context. Within a personal context, occupational therapy practitioners focus their treatment on all aspects of an individual, such as their gender, age, socioeconomic status, education status, along with their overall health.
The American Occupational Therapy Association's Centennial vision impacts the role of the practitioner by encouraging treatment interventions to be evidence-based to ensure the field of occupational therapy is science-driven and widely recognized. The vision also encourages practitioners to advocate for and promote the profession of occupational therapy to guarantee the field it continues to be recognized by consumers and referrers. Practitioners are also instrumental in guiding the field from a national to a global level.